Now that we are in the mid to late fall, merging on into the winter, we have seen, because of a variety of circumstances, a surge that has really surpassed the others, where we have between 100,000 and 200,000 cases a day, between 1,000 and 2,000 deaths per day, and over 90,000 hospitalizations. This is something that is quite problematic, and to say it's challenging is to really say the least. We expect, although we, and including your own governor, have almost been pleading about the kinds of things we need to do to mitigate as we get into both the colder climate as well as the holiday season. But we anticipate, given the numbers of people that have traveled and that have engaged in the kinds of family and friends gatherings indoors for dinners and other gatherings, that what we are likely going to see, and I'm going to get to in a minute that we can do something about it, a surge upon a surge. And what I mean by that is that the numbers were already going up. You usually see about 2.5 to 3 weeks following an event, whatever that event is, that precipitates new infections. Traveling is an event. Holiday gathering is an event. Indoor types of congregate settings is an event. So what we have seen already is the event has occurred, and we're going to be seeing the result of that in the next couple of weeks. Instead of thinking in terms of the Thanksgiving holiday and then the Christmas holiday as two separate events, I think we're going to be looking at 30 or more days of a period of time of precarious risk. Because even though we're so-called out of the Thanksgiving season, we are rapidly going to emerge into the season of people shopping, crowding, preparing, perhaps even the ill-advised office parties, if they can exist anymore, and then the Christmas holidays, and then New Year's Eve and New Year's Day.